Hello, good evening. How are you? And welcome again to another session of Ask the Doctors. Now, if you're just watching this program for the very first time, this program is Ask the Doctors every Sunday by 8 p.m. West African time. My name is Dr. Frederick Unwibohai, and I'm not here alone. I have my co host, Dr. Israel, and he will be joining us very soon. Please, something is important we have to tell you. On this program, we don't prescribe medications. Again, we don't make diagnosis. All we do here is to teach you so that in case you're asking us for medications and we don't respond to you, don't feel bad. The next thing again I will tell you is that if you are watching this program after we have ended, I'm sorry, we might not be able to respond to your comments. So right now we are live, and today's date is the 18th of June 2023. I can see we have some people already in the house. We are streaming live on Facebook, my two Facebook pages, and we are streaming live on YouTube. Now, today's topic is very, very interesting, and my guest is already in the house. We have somebody already on YouTube watching us from Sierra Leone. Yeah, who's this? Yeah, hey, Khadija, how are you? And then we have Ngozi. Ngozi, how are you? Watching from Germany. I see you, Ngozi. How are you? Ify, good evening, Ify. Welcome. Hey, Dr. Blessing, how far? Welcome. Okay, without wasting time, I want to bring up my guest right now. We have a lot to discuss. What's this? Oh, okay. We have a lot to talk about today. The reason, let me set up this camera. These village people, they want to disgrace their father, not me. Okay, we're back. Yeah, good. Okay, good, good. Welcome, everybody. Frida, I see you. So let me introduce our guest tonight to talk to us on IVF. Now, let me say something. It took me a while to bring her on the program. So please, if you have anybody that needs to know about IVF, I beg you, send them this link. Invite them now. Not that tomorrow you now tell me, Dr. Fred, I want to do IVF. Okay. So my guest today is Dr. Mojisola Aderonmu. She's a graduate of the University of Lagos. She finished in the year 2008. She had her residency in Lagos University Teaching Hospital and rounded up in 2018. She's a fellow of the West African College of Surgeons and National Postgraduate College of Nigeria in the Department of Obstetrics and Gynecology. She has a passion for maternal medicine, ultrasonography, and the management of infertility. She passionately, like it's her passion, she supports causes for well-being of women and girls. In her free time, she's engaged in advocacy and she supports non-governmental organizations, the Girl Aside, Habidel Foundation, Beyond the Classroom. She is the executive director of the Amira Feintola Foundation, a not-for-profit organization that awards scholarship to deserving secondary school students. She has publications in local and journals. She's also a member of the Nigerian Medical Association and the Society of Obstetrics and Gynecology. She has held several leadership positions, and she's currently the medical director at the Medical Arts Center, Ikeja, Lagos, Nigeria. Ladies and gentlemen, for the first time on Ask the Doctors program, please help me welcome Dr. Mojisola Aderonmu. Good evening, ma.
Good evening, Dr. Fred. It's a pleasure
Good
and a
evening.
privilege to be here.
Thank you very much, ma, for honoring us. I know you're so busy. We were supposed to have this discussion last week, but you were busy. Thank
Yeah,
you very, very much. And today is the
thank
Father's
you.
Day. So to all fathers, happy Father's Day. I forgot. Happy Father's Day to all the fathers in the house. So let's discuss quickly, ma, because of time. There
Okay.
is a question I really want to ask, and I know a lot of people are interested in asking you this question. Now, this question says, what is IVF? For somebody listening to us right now does not really understand what IVF means, please help us break IVF down.
Okay. It's a pretty simple definition. IVF means in vitro fertilization. When fertilization occurs outside of the body, that's simply what it means. So, For a woman to get pregnant, she'll have sexual intercourse. The sperm will be deposited in her vagina. It will swim up through the cervix, the womb, through the fallopian tubes, and then go to meet with the egg that has been released by the ovary. That fertilization occurs inside the body. But when we have that process of the sperm meeting the egg outside of the body, then we call it in vitro fertilization. That's simply what it is.
In vitro fertilization.
Yeah.
If you have a question on IVF, please just hold on. We'll be coming to you soon, soon. But let me ask her some questions that you sent to me. Now, people will be wondering, okay, what is the reason? Why should I go for IVF? Why should an individual want to have fertilization outside of a human body? Meaning that why should we be talking about IVF today, ma?
Okay, so you know, getting pregnant is easy for some people. For other people, it's not as easy and it's not as simple. Some of them may already have reasons why getting pregnant naturally by themselves is difficult. Things like previous disease, cancer diagnosis, and treatment, uh, even congenital, the way some people are born. Some people are born without a womb, without a uterus, but they have their ovaries. That's something we call the Mullerian agenesis spectrum. So there people have different reasons why they would need assistance. So the what science does is to be able to offer assistance to people who the sperm and the egg cannot meet within the body. And then science is able to do that in a lab and then be able to have that embryo. That's the potential human being. All of us started as embryos, so the potential human being reaches the embryo and then to put it back into a womb. So science just bypasses what the natural process would have done. So
Hmm.
yeah.
Thank you very much. If you're just coming, you're welcome. We're talking about IVF tonight, and we have Dr. Mojisola with us today. Please help me share this live stream. Share on your page so that we can get more people to watch us. And then there's something I forgot. There's someone sent me money. Someone transferred money to me yesterday. One of my followers online. In case you are watching, I want to say thank you. Your name is Alekwe Veronica. Thank you very much. Thank you very, very much. Now, man, I don't know if this question is linked to the last one I just asked. Maybe you will help us. Who is qualified to go for IVF? A woman just says, I can't get pregnant, therefore I want to go for IVF. Can anybody just wake up and say, oh, this IVF looks very interesting. I like the language. I want to go for it. Or someone has to meet a certain criteria or qualify for IVF.
So yes, someone has to have, we call it an indication, a reason. So that person would have, seen a doctor, and they would have had a diagnosis of infertility. That means they've been having regular unprotected sexual intercourse for 12 months and they haven't been able to achieve pregnancy. So when they've done all that, or even for some women, we use 6 months, especially when there is an indication that warrants an earlier intervention. So, for example, let's say one of the couple has had maybe cancer in the past and they've had to have chemotherapy. They already have an indication. We are not going to be waiting another 1 year after they get married, because we know that there's a reason why these people may struggle to get pregnant. So there has to be a reason why IVF, because it's not like Panadol. You just go to the pharmacy and say, give me Panadol over there, and they give you. Yeah. So there has to be an indication. The reason why the pregnancy hasn't come about naturally would have been evaluated. Is it from the male side? Is it from the female side? Is it a combination of both? Because there are couples who have a combination of both factors. And then is it that it's even unexplained? They've had several tests and all the tests are fine, but they are still not getting pregnant. So unexplained infertility itself is also an indication for IVF. For some people, it may be that there's maybe for their job. So you may have something like on a career pathway, there are certain periods where for example, maybe a soldier, you have to be away for some years fighting. You can do some type of IVF procedures to be able to ensure that your family life can continue, your genetic line can continue, should in case something happens in the war front. So those are some of the indications why it may not be, it definitely won't be the same for everybody who is coming in for IVF, but there has to be a cogent reason why that person is coming for an IVF procedure.
Dr. Israel, good evening. How you day?
I'm fine. Oh, good evening. Happy Sunday. Good evening,
Good
man. Thank you
Good
for
evening,
joining
Dr.
us
Israel.
today.
Thank you for having me.
Oh,
Sorry,
Mark,
I
so
came a
let's,
bit late.
yes, welcome, Dr. Israel. Maybe you'll be taking the questions. So when it's time for questions, Dr. Israel will take that segment. Man, right now,
Okay.
because of time, we are moving. I have some other questions right now, but I want to ask this. What is the process like? So a woman is thinking to go for IVF. She and her partner, they are considering maybe IVF, but she's scared. The unknown is so much to her. So could you help us break what would happen, what she should expect if she should go for IVF?
Okay, so in a natural cycle, the woman will grow one egg, and then it is that one egg that will be released during ovulation. And it is that one egg that is released that the sperm will, at the time, if she has sexual intercourse around the time of ovulation, it is that one egg that the sperm will also fertilize. Now, in an IVF cycle, we'll usually be doing what we call a controlled ovarian hyperstimulation. We're looking at getting more than one egg because we want to maximize that cycle. However, we also don't want it to be so much that it's going to jeopardize the woman's health by having complications. So that's why we call it controlled. The way I explain it to my patients is those who are old enough to have driven manual cars. You know how you have to do some balancing with the accelerator and the clutch exactly.
Mm.
So you give some medications to grow the eggs, but you give some medications to ensure that they are not too exuberant. Now, when we do that stimulation, we scan regularly to ensure that the sizes of the egg follicles we see on scan get to maturity. When we've gotten to the size of maturity, then we do what we call a trigger. That's to cause that ovulation that occurs inside the body to now make it occur in a timely fashion whereby before it is released into the abdomen, the ovary is within the abdomen and there are other things there. There's the bowel, the intestine, there's the bladder and all of that, and the eggs are really microscopic. So if the ovary releases them, we can't get them again. So we time it so that we can then do what we call an oocyte retrieval. So at a particular time after giving the trigger, we then go in and do an oocyte retrieval in theater under light sedation. So the woman is under anesthesia, but it's not as deep as if she's having a major surgery. And it's usually 20-30 minutes and she's awake, she can go home. So that egg that has now been retrieved is handed over to the scientist. And the scientist now places the egg and the sperm together, and a lot of processes go on. They can either inject the sperm into the egg directly or they incubate them and then wait for fertilization. So in 24 hours after that, we'll be able to know how many of those eggs were fertilized and have now formed embryos. That means there has been a culmination of the genetic material from the woman, genetic material from the man, and it has formed a brand new human being. And that is how all of us started. We all started from one egg, one sperm. We formed one embryo, and then we continue to divide into many cells, and then we are here today. So when we have that fertilization, then we begin to monitor that embryo to see that it is growing well, and then we then transfer it depending on different parameters, which are technicalities. We then take that embryo and then put it back into the woman's uterus, and then wait for approximately 2 weeks. The 2 weeks period, it also mimics the mid cycle of ovulation to next menses. So if we do a pregnancy test 2 weeks after embryo transfer and it's positive, then we know that that woman definitely is pregnant. If we do it and it's negative, then we know she's not pregnant.
So
So
when you
that,
say a negative, meaning that after implanting the egg that been fertilized, it did not
yes,
stay in a very
it
lame
didn't.
word.
Yes. So
Yeah.
yes, it didn't stay. So usually the embryo, even in natural cycle, the embryo is formed and then it is swept back into the womb, and then about day 4, day 6, between day 4 and 6, it attaches to the lining of the womb and then embeds itself. It is when it has embedded itself and elaborates that pregnancy hormone that we can test it in the blood. But if
Mm,
that attachment and embedding is not successful, we won't get that hormone, and so we will not have a pregnancy.
mm. Thank you very much. If I just come in, you're welcome. Talking about IVF, and I know you have questions, but just hold on. We'll take your questions. I know that some people might be scared about the side effects because women have heard before you go for IVF, you might take some medications, maybe they might give you injections and the rest. So, should a woman expect any side effects? If yes, what would those side effects look like? That is, if there are, and
Okay.
how do you manage those side effects?
Okay, so in medicine, there's almost nothing that doesn't have a side effect. Even Panadol, taken in excessive quantities, will have side effects. So, and then the medications we use are hormonal. They have their own side effects. Some of them are mild, some of them are related to the mode of treatment. So, most of them are injections. So, side effects such as pain at the injection site, redness, swelling, those are some of them. Those ones can be managed by, appropriate technique. So if it should be a deep into the muscle injection, is given deep into the muscle, not at the surface. If it's supposed to be under the skin, just a little bit under the skin, then it's given that way. If there's any redness or swelling, ice packs can help with that. So those are some of the mild ones. I have some of my patients complain about mood swings, headaches, swelling of their legs, and those are hormone based. Some of those can just be, if they know about it before the treatment, it makes it easier. Say, okay, yes, the doctor mentioned I may experience this. But if suddenly they find their legs just swelling up, they may get worried, and so the full spectrum of side effects may not occur in one person. They may just have one minor one really, really bothersome one. But yes, there are side effects like that. There are side effects.
My next question would be on the IVF working. A woman says she's going for IVF, she has done the cycle, and then they are saying she's not pregnant. So, is it possible that the woman can actually go for IVF after the whole counseling, the whole discussion, and the embryo has been inserted, but it's not working? Is there a possibility? And if it does happen, how do you help the patient come out of that phase of it not working?
That's a very great question. Um, the practice of fertility, it's a very emotive one, both for the patients and even the doctor as well.
Hmm.
One of the ways to explain this is that it's not every cycle, that's every monthly cycle, where a fertile young couple are having sex at the time of ovulation that they get pregnant.
Mm.
Otherwise, we'll be more than 200 and something million in Nigeria. So there are times that the man is fine, the woman is fine, they are having sex at the time that ovulation is occurring, but they are not getting pregnant, even though they are not using contraception. So that can also occur in IVF. It's just that you now have to isolate, the different things that make up pregnancy. Is the egg there? Is the sperm good? Is the quality of the embryo good? Was the lining of the womb okay? Those are the things that you check the boxes to be able to say, okay, this is one reason why this should work. This is one reason why this may not work. One of the really important aspects of IVF practice is counseling. Counseling, because it's important for the couple to know that even though they and the team are expecting a positive result, there is the chance that it may not work that first time. There's even the chance it may not work a second time. I don't know if you get me. So it
Mm.
doesn't mean there's something wrong with the process itself. Yes, there may be adjustments. Okay, maybe use this drug, use that drug, but there's nobody who can really tell you that once you do it once like this, you must get pregnant. Otherwise, we would have been playing God. So there's still that aspect of IVF that you cannot put your hand on your chest and say I did it. You can't do that. So the counseling addresses that part, that even if everything checks out, the ovarian reserve is great, the semen count is fine, the quality of embryos were good, the endometrium on scan was great, there may still be a negative pregnancy test, meaning that cycle did not work. It doesn't mean that they must give up. I've had patients who the first cycle failed and they broke down thinking, oh, then there's no hope. And I said, no, you can't do that. You have embryos left. The embryos are good grades. And you have your womb is fine. There's no fibroid or anything obstructing. Let's try again. And second time around, they get pregnant. And they're like, oh, but why didn't it happen the first time? I don't know. I can't lie that I know. But I knew that if all those aspects had checked out, it was a matter of trying again. It was bound to happen. I wouldn't have been able to say, oh, it's the second time it will be. It may have been the third time. But that's the honest truth. It's just to check those boxes and see that there are actually no problems in all those areas before you go ahead. And that's the power of a complete evaluation before you even get to the IVF. It's not just, oh, I want to do IVF tomorrow. No, all those things must have checked out so that if there are, for example, if a woman comes in and says she wants to do IVF and she has a huge fibroid like it's like 8 months, I know that I can't go ahead with that IVF, because then when we have the embryo, where are we going to put the embryo into? Even if she gets pregnant and has a
Mm.
miscarriage, it's still a loss for that IVF because there was no live birth from that IVF. So all the evaluation must check out before the couple proceed with the IVF. So counseling
Oh,
helps.
mm.
Yes, counseling helps to say, do the evaluations. Let's know if there are any problems. However, while we are aiming for a positive result, there is the chance. It's just like life. All of us wake up in the morning and go out of the house, but nobody goes out of their house expecting to fall into a gutter on that day. But it may happen. You may just miss a footing and then fall. So it's just that way. It may happen. It's a risk in IVF treatment, but the reward of a positive outcome far outweighs it. Yeah.
Mm. Yeah, the reward at the end, you forget all the
Yeah,
suffering, all the pains. Um, I
I know.
know that based on this question I just asked right now means it can fail. So what will be the success rate like? Oh, we had about a
Great.
hundred women come for IVF. How many are we looking at that would come out successful if sometimes it can fail?
So that's a very common question, and it's a good one because there also is no straightforward way to answer it. So
Hmm.
what is doable is to try and have similar patients, maybe the same age group of the woman, the same age group of the man, men that have, this type of semen parameters, women that their ovarian count and all of that is this way. But it's usually not like that in real life. Even in general practice, every 50 patients who come in, they may all come in with headache, but they are not really the same people. Some may be really huge, some may be really skinny, some may be short, some may be tall. So it's not easy to put a blanket on this is the type of patient I'm going to treat. And those patient characteristics also affect the success rate for IVF. So, for example, women who are much older, their ovarian reserve may likely be lower than women who are younger than 35. So that can impact on their success rate. Some women who are older may still not want to use donor eggs, and that can impact on the quality of embryos they get and the success. Overall, IVF should give a success rate in the total population.
Hmm.
Natural conception occurs at about 20%. IVF can increase that fertility rate to about 40%. And that's good. That means that there are still some 60% that, it doesn't matter what we are going to do about it. But from 20% to 40% is a lot, especially when we look at population of the world. And that's a significant one. Now, if we're able to get 40%, so that's every 10 people who come, 4 people are pregnant. That's a very good IVF rate. When you now begin to control for, if the woman is too old, don't use her egg, use a donor egg. If the sperm is bad, use donor sperm and things like that. You can then get higher than that, so that if you treat 10 patients, more than 5 of them will be pregnant by the time you control for all the different characteristics that may be peculiar to the couple.
Hmm.
So there's
Hmm.
no 100%.
There's no 100%.
No, there's
Wow.
no 100%.
I want to ask a very, very important question that I know is in the mind of a lot of people. But before I ask that,
Okay.
please help us share this live. We're on YouTube, on Facebook. We are streaming on 5 platforms simultaneously. Before I ask that question, Ma, I want to ask this: How common is IVF in Nigeria? Are people aware of IVF, or is something
Oh
that
yes,
people don't like talking about it? Is it common?
very common. Very
Because
common.
there are comments like IVF babies are not normal babies. If you give birth through IVF, this misconception that the babies are not strong, IVF baby
No,
are not smart.
no, that's not true. So IVF is very common, very common. At least in the area where I practice, there are more than 10 clinics within a, should I say, 20-kilometer radius. So
Wow.
pretty common. And there are IVF clinics outside. Yes, this is Lagos, but there are IVF clinics outside Lagos: Abuja, Port Harcourt, Warri, Benin, yeah, all over the place. Ondo, everywhere. Even in the north, there's IVF practice in the north. So, what I have found in practice and experience is that people come in to do IVF, okay, and they get pregnant. It's successful. They have the babies, and then testimony time is that God did it. There's no mention of IVF. And that doesn't help other people who are waiting
Mm,
to know
mm.
that it wasn't just prayer these people were doing, they also went to do IVF. So people keep waiting and waiting, saying, oh, but those people, they were only praying, not knowing that it wasn't only prayer. So
Mm.
I still find some of my clients, after they've had a baby, and I say, oh, could you give us a testimonial? And they're like, oh, well, make it anonymous, don't show my face, or don't show. And I'm like, how are you going to help other people? So yes, people still, not because they think the babies are abnormal.
Mm-hmm.
I don't think so. It may just still be that you want to hide, what you did. It doesn't make it less of a testimony to say it's IVF and God made it work, because it that's just what it is. So there is still that part of it that people don't openly say what they did. I think the more we talk about it, the less the fear of, saying this is what I did and this is how my baby came about. But in terms of whether the babies are normal, babies are absolutely normal. Absolutely normal. Absolutely normal.
So you heard though the babies are normal, and it doesn't make it less of a testimony if you mention IVF. Mentioning IVF, you're encouraging others to also try the process. Somebody contacted me some time ago, a long time ago, in
Okay?
Europe, wanted to come to Nigeria for IVF because of the amounts, the costs of IVF over there. So they were
Yeah.
like, please, oh, how much is IVF? I say, I know they do IVF. I don't know, but it's within this range. And somebody asked me privately before coming online, please, how much is it? So I want to ask you, Ma, what is the cost like?
Okay. So I would start by saying that it is affordable. Um Affordable, I'm using the word affordable because yes, some people may be able to outrightly pay for it. Some people may need to save for it, but it is
Hmm.
affordable. It's not like um saying, oh, I want to go to space. I may not save up that money in good time to be alive to go to space. But if it's I want to do IVF, yes, it's possible for you to save up that money to do IVF. So it's also possible for you to pay for it out of pocket. um the price range is different in different parts of the country. Those of us who live in Lagos know Lagos is a more expensive town. Those of us who live outside of Lagos, we also think, okay, it's not as expensive as living in Lagos, Abuja, or Port Harcourt. It also depends on the type of IVF. So when people are
Hmm.
using their own gametes, that's their own egg, their own sperm, it's cheaper than when they have to use donor gametes for their treatment cycle. So those things make up the difference in prices. And it can go from anywhere from 500,000 to up to 5 million naira, depending on where you are and what type of
Hmm.
treatment it is. But it is affordable. It is.
It is affordable. Okay, we'll be taking questions after this. So if you have questions, please start dropping your questions. Um, we'll take as much as we can within this short time that we have here. But please, if you ask us any question outside IVF, I'm sorry, oh, we will not even comment on that question at all. I beg. Let's stay within the lines of this topic. Now, Ma, let's talk about this area of third party IVF. Third, I know the partner and the woman IVF. Now, there is a third party IVF. Whenever we hear the word third party, it's like there's another person involved. What does that really mean, please?
Okay, so you are correct. You've already gotten halfway through the process of describing it. So you have the man, you have the woman. Those are the two parties. The third party now has to do with somebody who is bringing something else into the mix of IVF. For those who joined at the beginning, they can remember me saying that you need the egg, you need the sperm, and you need the womb. That when the egg and sperm have formed the embryo, which all of us started from, then we need the womb that is going to carry that pregnancy. So a third party may be bringing either egg, which is donor egg, sperm, which is donor sperm, or the womb, in which case we are talking about a gestational carrier, or more commonly known as a surrogate. So those are the people who form the third party. So I'll just quickly give an example. So let's assume
Okay.
that there's a man who had childhood cancer, and maybe he had cancer at, let's say, 6 7 years old, and he had chemotherapy, and that had wiped out the um, spermatogenesis potential of the testes. As an adult who now wants his own family, he doesn't have the sperm to give to that process. So the couple can opt for an anonymous donor sperm,
Hmm.
do an IVF with that, using the woman's eggs, and then that embryo is put back into that woman. That's a third party IVF using donor sperm. If it's a woman, the same thing applies. We're taking donor egg from another person using the husband's sperm, but she has her uterus, so we put it into her uterus. That's a third party using donor egg. Now, if, for example, the man and the woman have their own, gametes, but let's say the woman's uterus is damaged, maybe she had, maybe she was involved in a vehicle accident, affected the womb, and they had to take it out. And so, even though she has her ovaries, she doesn't have the womb anymore. The embryos that are created, they are the genetic material of that couple, but they
Hmm.
can have a surrogate who will carry that pregnancy for them. And when the surrogate delivers the baby, hands over the baby to the parents who commissioned them. So that's the example of the third party, helping to solve a particular problem in that chain of fertilization and reproduction.
Hmm. Okay, let's take questions. Dr. Israel, just hey God, the network. Okay, can IVF take care of genotype incompatibility like AS and AS couple trying to get married? Can IVF solve this for them?
Yes, that's an excellent question. So yes, IVF can do that. And because we are going to be doing an additional procedure on that IVF. So IVF helps to create the embryo. So you've taken the sperm, you've taken the egg, you've fertilized them, they've combined to make an embryo. That's a potential human being. Now, before you transfer it into the womb of that woman, you can take biopsies, that's take small samples from it, and test it to know, does this embryo have sickle cell? Because that is what you are trying to avoid from the AS and the AS that have married themselves. And so the embryos, so let's assume this couple did the IVF. The man is AS, the woman is AS. And in the IVF process, they've given us 10 embryos. Embryo 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, we won't just put embryo into the woman immediately. We then test each of those embryos. And then the test, which is called a pre-implantation, because we haven't implanted into the womb, genetic testing to know what that embryo contains, now tells us, oh, embryo 1, 2, 3, 4, 5 has sickle cell, that's genotype SS. Embryo 6, 7 is AA. Embryo 8, 9, 10 is AS. And then you can recommend the unaffected ones for transfer. So that woman who you've tested all the 10 embryos and 1 to 5 is SS, you won't transfer any of those ones. You'll rather be transferring either an AA or an AS embryo into her. So yes, IVF can take care of that.
So you got your answer, Ike Chuku. Please, share this live stream for me now, for us. Please help me. People are not, you guys are not sharing now. Wow. Okay, we have another one here that says, "Good evening, doctor. Please, my question is: after using a donor egg for IVF, will the natural bonding of a mother and child still be there? And what are the psychological effects?"
Okay, so I'll put it this way. The donor egg and the husband's sperm have formed the embryo and the woman is carrying that embryo, she's pregnant with that child, it is her body that is going to nurture that child to term. It is her blood that is going to flow across the placenta barrier. It is her body that is going to ensure that pregnancy does not come preterm. It's her body that is going to, give that child the ambience to reach that 9 months. There's no way that woman will feel fetal kicks and not have a bond with that child. That's why you see most women, they'll go to the hospital and doctors everything is fine, they'll be like, "Ah, but I've not heard the baby's heartbeat," or they go and do a scan. If they don't hear that boom 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 on the scan machine, they are not ready to go home. So in that period of the 9 months, you are going to have a myriad of experiences that will nurture that bonding. And you are the one that will then choose later on in life either to disclose to the child or not, depending on how your relationship with that child is. But you carrying that pregnancy is all the time you need, really is all the time you need to develop a bond. There are no psychological effects on the child whatsoever. You are the one who is going to push, you are the one who is going to deliver the child, so the child doesn't know whether they came from a donor egg or from your egg. So there are no psychological effects, and you do have all the time to form a bond with that child.
Hmm. Dr. Israel, are you here now? Okay. Dr. Israel,
Yes.
you're muted though. Okay, is there any form of genetic interference in 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 from a supposed surrogate mother who carried the fetus to term?
Okay, no. So the way I explain this to my clients is this: you are renting. If you rent an apartment, you are not the owner of the building. You
Hmm.
rent and sign a lease that, oh, Mr. Landlord, I want to live in this your facility that you built for 1 year, and this is I promise to look after your environment. I will not damage anything and all of that. So the genetic material is from the egg and the sperm. The surrogate is just providing us the house that we are going to rent to carry that embryo to term. So she's not going to donate any genetic material whatsoever to that pregnancy. Her body is going to, carry the pregnancy, blood flow, her blood pressure is normal, it doesn't affect the baby. She doesn't have any infection, it doesn't affect the baby. So she's just helping us to provide the home that embryo will live for 9 months, and when she delivers the baby, hands over the baby to the parents, she has no genetic contribution to that child.
Okay. Uh,
Dr. Fred, can you hear me?
Yes, I can.
yes, we can hear you. So this one says, how about
Okay,
sex
thank God. Network has
selection?
been.
Isn't that also considered as an advantage of IVF over natural birth?
Okay, so that's skirting on some ethics and some controversies and all of that. But yes, just like you can use a PGT to know the genetic information of that embryo, you can also use a PGT to know this embryo that we've checked, is it AS, is it AA, is it SS, is it male, is it female. We also use it to check for aneuploidy, so that's to avoid things like Down syndrome, where there are genetic excessive or less than. So if every human being should have 46 chromosomes and then either an XX or an XY, if the embryo has 44, the PGT is going to pick it. So you know that there's something wrong with this embryo. If the embryo has 45, you know there's something wrong with it. If the embryo has 47, you know there's something wrong. So you won't be transferring an embryo that has an abnormal genetic composition. It's also one of the advantages of doing pre-implantation genetic testing.
Mm. Let's see. Okay. Wow. Some questions are coming in, and I think you've addressed them. So we'll skip them. You will have to watch from the beginning. So there's a
Okay.
question here says, "Hello, ma'am. Please, what's the cutoff age for a woman to have IVF, and how long does the treatment take?"
Okay, so the IVF process itself mimics a natural cycle. Most women will have a cycle within 1 month, one menses to the next menses. So the IVF process mimics that. However, there may be reasons to do some sort of pre-treatment depending on the peculiarities of that couple. So there may be a reason to give certain medications to prepare them adequately. So if, for example, there's a high level of prolactin hormone, you have to treat that to bring it down to normal. So those are some of the things that may extend it beyond that 4 week window. But the IVF itself, the process itself, is within a 4 5 week window to mimic the natural cycle. In Nigeria, we have the Association of Fertility and Reproductive Health guidelines, and that is what binds those of us who practice fertility medicine in Nigeria. And you cannot put an embryo in a woman above the age of 54 years old. If she's older than that, then she should be considering using a surrogate. If she's younger than that, she can, and she has a uterus that is fit, is she has no medical reasons not to be able to carry pregnancy, then yes, you can go ahead and carry a pregnancy. So you can have, I have 50-year-old women, 49, and they carry their babies and they've delivered. So it's possible to do that. But 54 years old is a cutoff to having to carry. She can still do IVF with, a surrogate carrying. She can even be less than 54 and need a surrogate to carry the pregnancy for her. So, but to carry the pregnancy herself, 54 years old is a cutoff in Nigeria.
Okay, Ma, we have a question here. I know you touched on this before. Maybe again, please. Can someone with fibroid go for IVF? This is from Ifunanya.
So the fact that a woman has fibroids doesn't mean that she cannot get pregnant or carry her baby. Even in obstetric practice, I have seen patients with fibroids carry their babies, but it depends on the size and where it is located in the womb. So with really big fibroids, the woman should do, do away with the fibroids, remove it either surgically or other non-invasive methods that are available now, and remove the fibroid before she does the IVF. So the location and the size are very important, and those are things that come up in the evaluation. By the time you do a scan, it will pick out where the fibroids are, what their sizes are, and then that will guide whether you need to do surgery before the IVF or you can proceed with the IVF like that.
Okay, we have about 10 minutes more. Thanks for mentioning ethics. Please, can you also tell us some other ethical concerns that are related to IVF?
Uh, okay, so that question is too broad, but I'll try to address it the best I can. So, just like with everything contractual, there has to be a contract for all of these processes. There has to be signed, informed consent forms that this process has been explained to the couple, they understand it, their questions have been raised, answers have been proffered, and they are willing to go ahead with it. So the ethics of it comes to play in that everything that this couple are likely to experience, they already are aware that it is a possibility, not that it will happen definitely, but it's a possibility They've weighed the risk and the benefits, and then they are willing to go ahead with it. Whenever third party comes into the IVF, of course, there's extensive documentation involving lawyers with that. So everybody's on the same page when it comes to that. The first rule of ethics, and that's the guiding principle in medicine and as well as in fertility practice, is do no harm. Do no harm. So whatever it is you are doing, do no harm. If it's going to harm the patient or the surrogate or the donor, then you have to call it off.
Mm,
So that's the
mm.
guiding law. Yeah.
Thank you, Ma. Somebody just sent me 50 stars. Ajayi Onhoba, I see you. Sent me stars. Thank you for the stars you send them. These are people that encourage us online. Okay, Ma, we have a comment from Anthony. He says, good evening. My name is Anthony. Is it possible for the couple to agree on twins or triplets of same sex via IVF?
Well, yes, once you've done the pre-implantation genetic testing, you have all the information you need to make that choice. So if all your embryos were tested and you have, let's say, two females, three males, and you want one female, one male, you can decide to choose that one female and one male embryo be transferred. Or if you want just females, you take transfer two of the females. Now, the higher the number of babies, the higher the risk of complications to both the mother and the babies. So it's not advisable to be aiming for triplets, quadruplets, and all of that. In in fact, in parts of the world, in the advanced part of the world is moving towards single embryo transfer so that you have just one baby in the womb. So, but yes, give it once you do a pre-implantation genetic testing, you have all the information to choose the sex of the embryos you want to transfer.
Okay, Alex Ogua, Ajayi sent me stars. Alex also sent me stars. I'm grateful. Thank you so much. Thank you very much. We have a comment here. Is the pre-implantation genetic test is it done as a routine for all embryo?
No, it's not. So it's an add-on. It's an add-on and it costs a lot of money. So so no, it's not done routinely. Um and that's because not everybody may require to have pre-implantation genetic testing. So if, for example, you have a 28-year-old woman, her husband is 29, and she had gotten pregnant before, but unfortunately she had bilateral ectopic pregnancy and she had lost her tubes. The reason why she's coming for IVF is not because she was unable to get pregnant. She's had a complication of a pregnancy, and so she cannot conceive naturally anymore. So her IVF does not require a pre-implantation genetic testing. But if you're having a, let's say, 40-year-old woman, she's coming in for trying to conceive, and she's had a previous child affected by, let's say, Down syndrome. For that couple, you are going to need to test the embryo so they don't have another child with special needs. So, those are some of the reasons why, and that's why you have to individualize the treatment plan with the couple to say, okay, these people need this or these people don't need this. And then they also will understand why they need what type of procedure or treatment that they are going for. So not everybody will get a PGT done for their IVF, but those who have an indication for it will definitely get it done.
Okay. If you are just coming and you ask us any question that our guest has attended to, you will have to watch from the beginning, because of time. We start 8 p.m. on the dot. Ma, if the first one failed, are they going to pay full amount again for the second or the third?
Okay, so that's a business question. So I can hide under the fact that I'm not a business person. But then that depends on there's no hard and fast about that. But what I would say is this. Um if you are going to be using new medications, you will have to pay something. You may get a discount from wherever it is you are having your treatment or not. But if you've used the medications to stimulate, they cannot collect it back from your body to do another cycle. You have to purchase another one. So in terms of consumables, that's a cost that may not be covered in one treatment. But in terms of professional fees and all of that, you may be able to get a negotiation on that. So I think that's the best I can do with that question.
Okay. The first part of this question, Dr. Israel, your network has been messing up. Oh, sorry, sir.
I don't I don't understand why the network decided to do like this today or 4 days.
Good evening, doctor. Can a woman with, I believe, high blood pressure, because you're saying BP, so BP high, can a woman with high blood pressure carry a baby of IVF? That is, go for IVF, basically. And then
So
she's asking for the cost again. So maybe you just include that in passing, ma.
I think we are talking about the cost. The cost depends on
Yes.
where you are and what is available around you. But the cost is affordable. If you can't pay outrightly, it's something you'll be able to save up for. A woman with blood pressure. So the evaluation of that woman, we'll be able to know if she'll be able to carry or not. So it's not just about the blood pressure. What's causing the blood pressure? If it's something that is amenable to medications and something that is amenable to pregnancy, because there are certain conditions that may be the underlying reason why she has a high blood pressure, and so she cannot carry a pregnancy because of that. So those things will come up. But I've had patients who had what we call primary hypertension, and they are well controlled on their medications, and they've gone ahead with their IVF successfully. So it depends on the peculiar circumstances of that woman.
Okay. Dr. Israel, you have any question to ask? Because we're rounding up very soon. What is the maximum number of embryo that can be transferred? This number, hey,
Well, you cannot have all the children of Father Abraham in one IVF cycle. So let's stick with two. One is recommended, maximum of two.
okay. Dr. Israel,
I don't think
okay,
I have any question though,
okay,
because
okay.
any question I'm going to ask, I think answered it. I
Yeah,
believe you have answered it already. So I may just watch the live session again.
okay,
Okay.
okay.
Thank
Yes.
you very much.
Okay. We have few more minutes. Let's see. Oh, I got another stars. Thank you. Thank you, Mar. Thank you, Mar. I see the stars. Thank you. Okay. Titilayo is just coming. Titilayo, you will watch from the beginning again. Okay, we have this comment here as we round up. Between the PGT and using a donor egg, which is more expensive?
PGT. PGT is
PGT.
more expensive.
Okay. PGT is more expensive. Okay, which other comment do we have here again? Okay, we don't have any. Please, how much is okay. Please, how much is donor egg? Hey God. Ma.
I don't think I'll be able to answer that one.
Okay.
Yeah.
Yes, we are out of time. But I have one question for those
All
who
right.
are watching, who are abroad, because I know I have a lot of them following me online. Some of them might want to come to Nigeria for IVF, most likely. Because I have some of them. What time frame would you want them to have at the back of their mind? Because some women believe that when I just land inside Nigeria like this, I enter, everything starts. So, what would you want them to know as they prepare to come over to Nigeria?
Okay. So usually they can plan their trip. The protocols are pretty flexible. Most of the time, we'll start with their menses. So if there are people who need some form of pre-treatment, they can do their pre-treatment while they are abroad. And
Mm,
so just come in a few days before their menses starts, and then do the IVF, get the egg retrieved, have fertilization, get the embryo transferred, and then they can go back. So they can actually complete everything within 4 weeks. Arrive, just with their menses starting, and then complete their procedure and go back.
Final question, because the other ones coming, they've been attended to. Final question, Ma. And this is for a couple that have been trying to conceive. First year, second year, third year, no cause of infertility, unexplained infertility. What advice would you have for them? How long would you want them to wait before they begin to consider assisted reproduction?
They should already be considering assisted reproduction,
Hmm.
because if they've waited 1 year, that's 12 months, and they didn't get pregnant naturally, and they've gone a good step further and gone for evaluations and everything has checked out, is unexplained, and they should be considering IVF. They should be. The earlier they do, the better their chances. The younger they are, the better their chances.
The younger they are, the better their chances.
Yeah.
Thank you, Ma. Ma, do you have any final words with regarding the IVF? It's been a very engaging session. I've been getting comments like very engaging. Any final words, any advice?
So science has helped us a whole lot. This whole IVF started in the late 1970s, 1976, and it has brought so much joy to people. We have millions of babies born from IVF all over the world. For those who need the science, it's available. Let's not, be so afraid to walk through that door. Many people have their babies, and like I said, testimonies don't mention IVF, but IVF is somewhere there. So if you
Hmm.
hear the testimony, don't just listen to that part that omitted the IVF. Think of IVF and see your doctor.
Think of IVF and see your doctor. So there was a question, but I didn't take it. In case you are watching, the person was asking me about how to contact you. Ma, would you want to talk about that? Someone asked that,
Okay,
or send me
that's
a mail. I
fine.
don't know. Anyone?
That's fine. I work at Medical Arts Center, so they can contact info at medicalartscenter.com. You'll
Okay.
definitely get a response. Yes. Info
Okay.
info at medical medical art center center.com.
.com.
center.com. Yes. So someone will
Thank
definitely reach
you,
out.
thank you so much, Ma. Thank you.
Thank you
I
for
really,
having me.
I really appreciate. Thank you very much, Ma. It's
I'm glad
such
to have
an
made
honor.
the time.
I hope maybe another time when you're less busy, we'll try to book appointment to have you again on the program, Ma.
I'll do my best. We'll plan it,
Yes,
ahead of the
yes,
time.
yes.
All
Sure.
right.
Thank you very much, Ma. Take care and
Thank you.
have a wonderful
Thank you,
evening.
Dr. Israel.
Thank you. Bye bye, Ma. Okay, ladies and gentlemen, thank you very much. We have to go now. We work with our time. I don't have a, oh, that's true, a handle. Okay, I will speak with her. And then when I'm cutting these clips, I could put up a handle there. But you can reach out to them at info@medicalartscenter.com. Thank you to all the people that sent stars. I appreciate you. If you're just watching, please go back to the beginning of this video. Take your time and watch it. I believe it will do you a whole lot of good. This program is every Sunday, 8 p.m. We know they do African time here. When it's 8 o'clock on the dot, we don't start. And we have been doing this program like this for 3 years. We know they come late. So when it's 8 o'clock, we don't start. When it's 9 p.m., we they round up. So in case you just they come, no vex. Go back and watch from the very beginning. Like I always tell you, good life now waiting. Good life. That sense. Thank you, everybody. Mr. Alex, Ajayi, Mommy, Ikaite, I saw your stars. Thank you very much. I shared a lot. Thank you. Because say we know the show, but before here, people know God I can't watch. Okay, now I love you all. Take care and have a wonderful evening. Bye bye. Bye bye. Bye bye.